As America's first research university, Johns Hopkins was founded on the principle that by pursuing big ideas and sharing what we learn, we can make the world a better place. We are honored to host your 72nd annual national seminar. Education writers have a vital role to play in advancing the national conversation on improving student well-being, safety, and success. Your work and ours is especially relevant because communities around the nation and the schools to which they entrust their children are facing a bewildering landscape of new challenges. Columbine, Sandy Hook, Parkland, and Santa Fe, Texas, and Roseburg, Oregon, and Charlotte, North Carolina, and Baltimore, right here in Johns Hopkins' hometown, where this past February a staff member was shot at Frederick Douglass High School, just 4 miles away from where we're sitting right now. Grieved, politicized, these tragedies borne by our communities have been woven into our collective experience. They have changed the way we think about student safety and about school safety. As the professionals who cover the education beat, you know all too well how the fear of violence has penetrated and changed the way we think about schools today. We are in danger of raising a generation of children who are afraid to go to school. Yet policy debates and initial reactions set off by school shooting events in urban, suburban, and rural districts alike have gravitated toward narrowly focused and reactive solutions. Biometric scanners, bulletproof lunch trays, SROs armed with AR-15s. The research tells us, and most teachers and school leaders will confirm, this narrow focus on trying to prevent or even anticipate gun violence does not take into account the much broader array of complex challenges that affect the safety and well-being of students, teachers, and schools. Suicide is the third leading cause of death among young people between the ages 10 to 24. It results in about 4,600 deaths per year. In 2017, more than 20% of students ages 12 to 18 say they were bullied in school. Black students, who account for 15% of all public school students last year, represented 39% of students suspended in disciplinary actions. And 14 million kids attend a school with a dedicated school security officer, but no mental health professional. The truth is that disciplinary actions, bullying, suicide, mental health, and other challenges of student safety and well-being are related. Gun violence is part of that web of influence, but it's seldom understood that way, even by many school leaders across the nation. Last year, as some of you in this room probably reported, a district superintendent in Pennsylvania said that he would supply his classroom with 5-gallon buckets of rocks to ward off armed intruders. Understandably, that idea was ridiculed, but maybe unfairly. As foolish as it may sound, the big bucket of rocks response is only one of the many knee-jerk reactions that typically emerge after violent events grab the headlines. Why? School leaders are responding to fear. Policymakers are responding to fear. The understandable fear expressed by parents, staff, and communities that motivates them to do something, anything, to ease minds. But fear cannot be the basis for effective educational policy and practice. We need to do more to ensure that school leaders have the training and resources to create and maintain safe and healthy schools. When school shooting incidents have occurred, in my role as Dean of the Johns Hopkins School of Education, I've sometimes been asked by reporters, including some of you in this room, to talk about what we're doing at Hopkins to solve the problem. To date, I haven't been satisfied with my answer. Schools of education have often been criticized for not adapting to the times, for conducting that research that is not useful for school communities and school leaders. That needs to change now. That's why we are launching today the Johns Hopkins Center for Safe and Healthy Schools. The center is dedicated to addressing the complex and urgent issues of creating safe and healthy environments with comprehensive evidence-based solutions for districts and schools. Other universities are making important contributions for understanding facets of these issues, but Johns Hopkins is the first higher education institution to put the many pieces of school safety and health together in one cross-disciplinary center dedicated to addressing them comprehensively. We have gathered a world-class team of researchers from across Johns Hopkins, education, public health, arts and sciences, and our applied physics lab to apply their expertise around practices, programs, tools, and policies integral to safe and healthy school environments. We are moving siloed conversations about pressing issues like suicide, trauma, bullying, and gun violence into a more holistic discussion about how we as a nation can make schools safer. We are building on our knowledge and tapping our deep bench of experts to design effective solutions for districts and schools across three critical areas: health and wellness, school climate and community engagement, and school security and technology. Over the next few days, you have the opportunity to engage with a dozen of Johns Hopkins faculty and alumni, the leading thinkers on reducing school absenteeism, restorative practices, adolescent mental health, community-based suicide prevention, and other important issues closely linked to safe and healthy schools. And in the months ahead, we will be releasing new research, best practices, tools, and resources that can be used by districts and schools nationwide. We will be embedding Safe and Healthy Schools program into our core curriculum in counseling, teacher preparation, special education, and administration and supervision to make it an integral part of training the next generation of educators. This is a definitive 21st century education issue, and I think you'll see many schools of education beginning to follow suit. We will be sharing our knowledge with teachers and school leaders nationwide through a pioneering suite of micro-credentialing courses in safe and healthy schools. And we will be working with the only national comprehensive study of school security and technology we produced with the Applied Physics Lab and translating that evidence to help practitioners make informed decisions about school safety. We will also be announcing a new director for the Johns Hopkins Center for Safe and Healthy Schools, a national leader in the field who can guide our comprehensive, holistic effort. In the late 19th century, the Johns Hopkins School of Medicine led the way in transforming the practice of medicine. In the 20th century, the Johns Hopkins Bloomberg School of Public Health led the way in protecting populations from illness and injury by pioneering research and practices in public health. And in the 21st century, the School of Education will lead the way toward an evidence-based transformation of education. The Johns Hopkins Center for Safe and Healthy Schools is a critical part of that vision. All students deserve to go to school in safe and healthy environments where they can learn and thrive. I look forward to partnering with you to continue this important conversation. Thank you.